Welcome back to Doctoring You. I'm Dr. Michael Sue. Since last recording on COVID-19, I hope everybody's managing and social separation, as well as not getting sick, staying healthy. Today I would like to attack three different topics. Number one, I think is very important to everyone, is how do you choose a doctor that is going to be personable to yourself and your needs. The second part is how do you choose a hospital should you ever need to go to one. And thirdly, I like to talk a little bit about what do you need to know that you are failing in health, and when do you need to go and see a doctor. So let's start with number one, choosing a doctor for yourself. Now, we are all human beings with our different needs, and we have extreme opinions about what we want individually, and we are also influenced by our surrounding, by our family, our friends, and our own history and experience. So having to deal with all these topics, one has to be, shall we say, pretty dogmatic about how you should think of selecting a doctor. Now, everybody wants to have the best. I want to have the best, but then it doesn't come easy and is not available anytime you want to. And of course, there's this issue of what doctor belongs to what health plan. And so it's not just what you want, it's what other people and what the industry dictates what you can or cannot have. So let's start with the basic. Somebody who is young, like in pediatric age group, say 5 and under, and then there's a group that is after, say, between the teenage period from 5 to teenage, and then after 18, 19, and until you're in your 30s and 40s, you have different needs. And then of course the geriatric age group, which is 65 and over. Let's talk in general, because to cover all those age groups is going to be difficult. Let's assume that your parents are a good decision maker for you when you're young. And when you become 19, 20, 21, you have your own mindset as who you want to go to. If you're a female, you may want to have a female doctor. And some people said, that's fine, I want to go to a doctor that can take care of everything, whether male or female. Then you have to decide who is the doctor who can provide all the services that you want in one location and have the know-how to deal with all of the above. It's a difficult task because to navigate through the health industry, one has to know what your experience as to what has been good or bad for you. Some people, after one bad experience, say, forget it, I'm not going back to that doctor. Can one experience determine your lifetime of needs from one provider? And of course, we are all different because of our cultural background, our upbringing, and also where you have been living in your lifetime. If you're with the military, you will go from countries to countries, and your experience is different. And also people with different cultural background, like if you're from Southeast Asia, Europe, Latin America, all these different places will offer different so-called different quality and approach in healthcare. So it's not that easy. So have to consider all the above to make your judgment call. And I've lived in 5 different countries, so I think I know a few things about different approaches in different areas of the world. And so let's approach the personality of the doctor, okay? So this is very important because most of us actually go by word of mouth. And they say, well, I've heard about this doctor and he or she seems to be the kind that I like. And usually the word of mouth is from your friends, your colleagues, and your family. And it may be very different to the individual as to who you trust best. And some say, well, my parents are in the 80s, I'm not going to go to a doctor who is way up there in age. And some will say, well, I'm in my 20s, I want to go to a doctor who's savvy on high techs. Of course, when you're younger than that, you probably don't see a doctor anyway, not as much as you should. And of course, when you are really a toddler, you leave it to your parents. Now, so let's take an average age group, say in your 30s and 40s. So if you move around the country, you move with your jobs, you're going to have to worry about, who do I know? Now, when you don't know anybody, what do you do? And the first thing I would say is that you look into the medical societies that these doctors belong to. Of course, you go online and you check their credentials and whether there's any complaints, big or small, about the individual. And I can tell you, although I don't, I don't look into my Yelp complaints much. This last time was probably years. I don't really rely on some of these things to say, for instance, I pick a specialist for my patients because I usually have to know them by my experience with them after years and years of referral. So, but we'll come back to that, the specialist. So in primary care, for instance, I think aside from looking them up online and looking at reviews from, say, other friends and neighbors, I would say it's always a good thing to have a first consult, to see if that consult is something brings out the problems that you want to take care of, because it's almost like an interview with a doctor. But it is not the kind of interview you go to a job and you talk to so-and-so and see the chemistry is good. A lot of times it is a time to whether you can relate to each other well. Now, one time is not absolute, because I have patients been with me for decades, and no matter if we have any kind of semi-heated argument or anything like that, which doesn't happen, but usually they say, that's Dr. Sue, that's his, that's who he is. And they don't put too much to it. It's just, he's trying to do something better for me. So he's very insistent me stop smoking, stop drinking, stop taking crack and doing cocaine, all that kind of stuff. So it comes from the heart. I think that's important, that when you feel that that doctor is actually doing something for you personally and for the good of your health. And of course, some doctors who go everything your way may not be the best. You can tell by that, they're very soft-hearted. Oh, that's what you want? Yes, of course, you can have it. You want this, you want that, they will cave into you. Sometimes it's not a good thing. To me, I think a doctor has to be firm in his or her opinion as far as what they can do for you that's positive. First, of course, do no harm. I think that's something we all take our Hippocratic oath to say that we don't do anything harmful. So, having said all that, it boils down to you as to how you select. Now, everyone's going to be, after 50 different visits, there may be one or two bad experiences for you. And I don't think, you should judge a person, which is really a working relationship. And in this case, it's very high up in the level of medical and healthcare. It is not something you should right away judge poorly on the individual. And I speak out of my own experience. For instance, a patient, without mentioning names, so after years of me telling them, you should take medication for your cholesterol, it's so high, you're at risk for heart attack and stroke. And numerous of them said, well, I'm too young, Dr. Sue. If I take this medicine, is this for life? If I take this blood pressure pill, is this for life? I don't want to go that way, okay? So after 5-10 years, eventually that person had a stroke, okay, or they have a heart attack. Now, hindsight is 20/20. How do you tell a person, well, I told you so, because it already happened? And they're lucky if they are alive. The worst part if you have a stroke is, well, you can't walk, you can't talk. Now, the injury is not so much to the individual, it's your family and friends, your loved ones, they have to look after you. So your choice of taking the advice from a doctor is very important. And how you see eye to eye with that person. If you don't think you're going to follow their advice from day one, then I think that may not be your choice of a doctor. So it has to be somebody you respect, and it's not going to be just sound in the ear that it comes in one ear and out the other because it makes no sense to you and you don't really care. So I think that's very important because some patients are much more indulging when they hear advice from their friends. If something ever happened to a friend, they come to the doctor right away and say, well, I want this checked. Now that friend, of course, is much more convincing than seeing a doctor for 15-20 minutes. Because that friend is around you almost, if not daily, is by phone, and their words is much stronger. Okay, I think I've spoken enough to touch on the personal needs. So basically, it's personal. Your experience as far as your cultural upbringing is very important. Europeans and overall is not as shall we say, demanding, and everything has to be done. And overall, I think not that because they are brought up that way. I mean, they see a doctor, they just say, okay, that's what the doctor said, and they stop there. But I think overall, since the internet, things have changed a great deal because people come in and tell you what they want because they have read about this. And that's another side of practice. So cultural background, your linguistic is very important. People don't understand what you're saying because, you don't speak their mother tongue. That's very important because if they don't understand you, no matter how you explain, if their English ability is beginners, or if the science background is nil, you can explain all you want, and the anatomy is hard for them to understand. And it's not the fault of the patient, and it's not the fault of the doctor. So you don't have the meetings of the mind, and confusion and misunderstanding can easily happen. So you may want to bring somebody who can understand and translate for you. I think that would be it's an improvement of quality care, which I'm very passionate about, but we'll talk about that another time. Okay, for now, I'll switch to a different topic. That will be choosing a hospital.